able to take care of people. The next activity we're doing, which is great for people who are going to be trip sitting for their friends or their community, which is like a what's in your bag. I have my bag with me. And so I was gonna do a little show and tell with all of you. They found fentanyl in counterfeit Adderall. And so now there is Narcan and fentanyl testing strips like in every high school, middle school, and elementary school. Just in case.
Including Aspen High School.
Some of the substance on the strip, or like...
So these are actually like urine strips. So women who have ever taken a pregnancy test, you guys are familiar with how these work, men less so. What you would do is you would take a little bit of your powder. So let's say you have a baggie of powder. And what you want to do is like smush it around, because there could be like a little bit of fentanyl in this corner and not in this corner. And so if you can test the entire bag, which is usually putting some distilled water, like taking the powder, putting it in a thing, like in a little cup, putting some distilled water on it, and then dipping the fentanyl testing strip in it. And if it comes out positive, it means there's fentanyl in it. Please don't consume it. If it comes back negative, what do you do when your drugs get wet or when your powders get wet? You can slowly dehydrate them in a double boiler. You just like slowly, pot of water, pie plate, put the drugs, the liquefied drugs on it, and like slowly evaporate the liquid out of it, and then what is left is powder, crystallized powder on the bottom of the pie plate. Scrape it up, put it back in the bag. If you are at a music festival and you have no way of dehydrating something, you can mush it in the bag and try to get the bag like coated. Dump the drugs out, put water in the bag. Fentanyl testing strip. There are videos on YouTube. Altered States Integration, Dance Safe, Bunk Police all have videos of the correct ratio to powder and how to actually test them. But I mean, I can open this one so you guys can. There's also instructions on the back of the fentanyl testing strips, but you would like, this is a very large cup. We're gonna pretend that it's like, you know, a thimble. But put the drugs in it, put some water in it. You take the strip out. This, it looks like this. You take the white side and you dip it in and hold it in for like 5 seconds and then pull it out and read it in 4 minutes. You can also pass this around if you guys want to look at it. That's probably the easiest way. Obviously, nothing's 100%. There's always user error. There's always, but this is the safer way. I also have a battery pack that somebody can charge their phone on. The saddest thing in the world is when somebody loses their friends at a music festival and they are distressed and their phone is dead. And so having an extra battery pack that somebody can charge their phone with, like, can also be like, oh my God, you saved my day, you saved my trip, you saved my, and so always an extra chargy battery pack. With that chargy battery pack, I have this lovely fan that can plug into when somebody's out on a trip and all of a sudden they're like, clothes don't work anymore, or something breaks or something tears. Being able to sew a button onto somebody or just like mend something really quickly. There's also, you know, little scissors in here if you need to cut a tag that's bothering someone off their clothes. Little tweezers, nail clippers. So like anything that will like help mend clothing.
Can I point something out here? If you haven't noticed this theme of these really small fixes, because sometimes in a psychedelic experience, these small things are overwhelming. Psychedelics are amplifiers, so like a tag, right, can lead to a whole fixation loop, and just to be able to come in and be like, oh, I can fix this for you, can send somebody off in a completely different direction.
Yeah. I have flashlights and a headlamp. Being in the dark and not having light is really challenging for some people. A little extra. I have this little panda bag, and this bag contains things to fasten things to other things. So there are safety pins, there are mini binder clips, there is a piece of rope in here. There's also, there were carabiners, but they all got taken, but also a little keychain. And sometimes just being able to be like, I'm going to attach like this thing to you so you don't have to keep carrying it and it's not gonna fall off you and get lost. And so I use my carabiners in Turkey, but I usually have like little mini carabiners that you can like hook a room key or hook a car key to somebody's pants so they don't lose their things, because psychedelic exploration sometimes like splatters all of your things. You have like a stack of colored markers. Narcan basically depresses your respiratory system. Like it will make you stop breathing. You will lose, huh?
Fentanyl.
Yeah, fentanyl. Yeah. Fentanyl will make you stop breathing. It is a very potent opiate, and there is a difference. Usually within 10 minutes of ingesting a substance, you will start seeing the symptoms of a fentanyl overdose. They will become lethargic, so change of state. They will become lethargic. They will become unresponsive. They will become like really sleepy and basically look like they're passing out and stopping breathing.
Far too quickly.
Huh?
Far too quickly.
Yeah, within like 10 to 15 minutes of ingesting.
Opiates work on the base of the brain, the respiratory center. So you bigger doses, you just stop breathing.
Right.
And you can have the seizure at that point. Sometimes people think the person's having epilepsy or having a seizure because your brain does not get enough oxygen.
Right. And so that's why I usually have a pulse ox, like a pulse oximeter, because you can test people's blood oxygen levels. So if their breathing is becoming depressed, their oxygen levels will drop. Narcan works on basically, it knocks all the opiates off of your brain receptors. So if you are an opiate user or an opiate addict, and you are having an overdose and you are given Narcan, it will immediately put you into acute withdrawal. And so usually, like my paramedic friends are like, you like administer Narcan and then get out of the way because they will most likely projectile vomit as they come up. So if you don't want to get vomited on, like be out of that splash zone.
And you don't want them to aspirate.
And you don't also want them to aspirate. So good pieces of advice, even if it's with GHB or ketamine or anything that can cause vomiting, left lateral, putting people, right? Because the way your breathing tube and you don't want people to aspirate. If you are on your right side and they vomit, it can go into your lungs. So if somebody is having a really hard time, you don't want them to be like this, and you don't want them to be like this. You want them to be on their left side. You usually put your a knee down so they can't roll over, and you leave them on their left side, because if they vomit, they will not aspirate on their vomit if they are on their left side. And so if somebody is having a really hard time, you're waiting for the paramedics to come or something like that, you want to make sure that you put them in a left lateral position, always on your left side. Also, if you are having a hard time and you are having some nausea and you are not feeling well, remember to lay down on your left side. Roll onto your left side. You can actually line your back with pillows so you don't roll over. But if you are feeling like you are in distress and you are having lots of nausea, lay on your left side. Little tips and tricks from the paramedic community. And so Narcan, a lot of people who have long-standing opiate addiction and tolerance, when you give them Narcan, they will be quite angry with you because they will go into acute withdrawal. And so a lot of times people are like, you ruined my high, or you blah, 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 like, but also they're going through acute opiate withdrawal, and it's very physically painful because of the physical dependency. Makes you feel like you have like the worst flu of your life. I had the unfortunate pleasure of taking my ex-husband through multiple like periods of withdrawal while we were together, and so I'm quite familiar with the grumpiness of opiate withdrawal. You basically like feel like shit for like 6 months, 6 to 9 months when you detox off of opiates. And so that's why it's so hard, is because the length of time for you to basically feel normal is really hard for people to get through.
Is that the same for methadone, or is that worse?
I mean, I think that any like opiate substitute, it is gonna have a period of time of like depression.
Methadone has a much longer half-life. Morphine is about 3 to 6 hours, and methadone will be 8 to 36 hours.
Right.
So it takes a longer time to wear off. The doses are adjusted more from day to day, not within a day.
Right. And so if you're on methadone treatment and you want to get off methadone treatment to be abstinent from opiates, then you will still have that kind of, you like wean off of it, like you titrate off of it the same way you would titrate off benzos or alcohol or any other like physically dependent substance. And for your like brain chemical system to kind of be back at baseline, no matter what it is, about 6 months.
It's 5 times the half-life of the drug for it to be out of your system. Look up the half-life of your drug, 5 times that is out of your system.
And that's the same thing if you're going to, if people are going to drink ayahuasca and they're on certain medications, if you're going to participate in an MDMA clinical trial, you have to get off your antidepressants to be in the clinical trial, it's 5 times the half-life. And you can look up half-life of Adderall or half-life of Ativan and figure out what that, or half-life of Zoloft. Prozac's very long, it's like 45 days to be 5 times off the half-life. And so those are things that are challenging. Those are things that are challenging with wanting to engage in psychedelic practice if you are on existing medications. But to go back to the question of what does a fentanyl overdose or an opiate overdose look like, there is a difference, like in what unresponsive means, because can I use you as an example?
Yeah.
Like, well, come and sit here.
Okay.
Like when you want somebody to respond to you, you don't be like, hey Martha, are you okay? Like, right? Because you're not giving enough stimulation to respond to. You want to be like, hey, are you okay? And you can sternal rub someone, which is taking your knuckles and pressing it into their sternum, and it's very painful. And they will try to move your hand, right? And so if you're I'm not going to sternal you, but if you're sternal rubbing somebody and they're not moving their hand, they're about to die. Just like the same thing with the way that they taught me at Venice Family Clinic the last time I did a training is use your foot, pick up their foot, drop it. If their foot slams down, they're not responding, right? Some people they'll like help you, right? When people are conscious, they will try to move things that are painful. They will like, but when you feel dead weight, they are no longer responding. And so if you feel like somebody is having some sort of overdose, like here's like traumatized medical professional or mental health professional is like if you're gonna end up doing CPR on them, you're going to end up breaking their ribs anyway, Like you have to do CPR enough to break somebody's ribs. And so when you're talking about responding to someone, don't be gentle. Like the more like push them, sternal rub them, like shake them to get them to respond to you. And if they are not responding of like a hey get off me or moving their hands, like they're in medical distress.
You can look up the Glasgow coma score. Glasgow, like in Scotland.
Glasgow
And
coma
there are
score.
5 stages of the Glasgow coma score, which are deeper stages.
Yeah.
Coma.
And so if you want to get trained in things like that's a good like woofer EMT, you know, like how to save a life. Most harm reduction organizations will do Narcan trainings and distribute free Narcan. Nest is a Narcan distributor for the state of California. And so we have the training video of how to use Narcan on our website, and you can sign up and we'll send you free Narcan to anyone.
And the local resource again is High Rockies Harm Reduction, based in Carbondale.
Yeah, High Rocky Harm Reduction?
High Rockies.
High Rockies Harm Reduction.
Linked on our website.
Tissues, super helpful. A Tide stain stick, also super helpful when you spill something on yourself. Also shout wipes, right? Like it's amazing because you're in such a heightened state when you are on psychedelics that like something like I spilled coffee on myself is like, oh God, I ruined something. And then you like ruminate over the fact that you ruined something. And so having the things to fix the thing that might be broken, super helpful. I also have like extra batteries for like, you know, like little, those types of things. This is like the psychedelic Jewish mom emergency bag.
I use that Tide stick.
Here's the Tide sticks.
School bears.
Then I also have, I always have a chalk pen on me, right? Not a Sharpie, but a chalk pen. Because this can like write on somebody's windshield or write on a mirror and leave a note without being permanent. So if we have like, if we're at a music festival and we take somebody from their campsite to medical or to a sanctuary space, we can leave a note in their campsite for their friends to say, hey, we took Maggie to medical at this time, come find us. On somebody's windshield or on somebody's like mirror, really helpful. Electrolyte packs, a toothbrush. Oh man, there's actually, you can order these single-use, compostable, bamboo, pre-pasted toothbrushes. And when you are high and you have a bad taste in your mouth, and all you really want to do is brush your teeth, you can just break out a toothbrush and it's pre-pasted and it's made out of bamboo, so it can just like go into composting. And it also changes state, right? Breath mints, toothbrushes, tea tree, toothpicks, but don't give these to like super high people because they'll choke on them. A mindfold, right? These are quite comfortable. We can pass this around too. These are quite comfortable eye masks that are fully blackout, but you can have your eyes open inside of them. And so that's really wonderful. I have a friend who custom makes these with like overlaid leather. They're very like elaborate, beautiful. They're used in like sex and kink space. Explorer Band-Aids, like latex gloves. There are some people out there who get really sweaty on drugs or have vomited on themselves or have soiled themselves in some way, and you don't want to touch other people's bodily fluids. So always rubber gloves. And then I have, condoms, earplugs. I have, this is like Pepto-Bismol. People get stung by bees, people are having allergic reactions to things, breaking out into hives, like Milligrams of Benadryl. Like my standard trip kit of like if I'm going someplace, I'll set up an altar. I'll bring like a Jewish mom, a psychedelic Jewish mom bag with me everywhere I go, because you never know. And these little things are the things that can turn something that might be heading down a darker avenue back into the light.
Around here, an insect repellent might be good.
Huh?
Around here, an insect repellent might be good.
Oh yeah, sunscreen, aloe, like burn cream, insect repellent.
I would add to that eye drops.
In my first aid kit, I have a 10 milliliter sterile water tube that has the twist off cap. Because if somebody cuts themselves and you need to rinse something out and you're like out in the middle of the woods.